Well, hey everybody, welcome to this week's 3 Minutes of Vitality. I'm Dr. Tim Turlip. And this week we're going to talk about something that actually is a focal point of what we do here at the office. And it's actually referred to as a vertebral subluxation complex. Well, a mouthful of stuff. Why does everything have a mouthful of stuff? I'm not sure, but it does. Right, a vertebral subluxation complex, sometimes abbreviated, it's sometimes called VSC, and sometimes it's shortened simply to subluxation. And subluxation, what is it, and why? How do we get it, and how do we treat it? Well, subluxation, sub means less than. It's the prefix that means submarine, subway, below the street. So it's something that's beneath or less than. And a luxation is simply the fancy word for dislocation. So if I had a luxated shoulder, my shoulder would be dislocated. So if I have a subluxation, it's joint abnormality less than a dislocation. So what is a vertebral subluxation complex? Well, the word complex means that there's, yes, subluxated, the joint isn't working as appropriately as it should, but then it incorporates and is causing other problems and manifestations, including neurologic lesions, other soft tissue, meaning the ligaments, tendons, supporting structures, what's called the intercostal tissues, doesn't matter, but actually can be involved with this problem as well. So we get abnormal movement that's changing things, specifically the nervous system, right? So it really is one of the fancy things that's referred to sometimes as a functional lesion. I love that expression because if you think of lesion meaning abnormality, so it's an abnormality in function. I love that because that's really what it is. So the spinal joints are so important because the neurologic structures do get infected, which is where this vertebral subluxation complex comes in because of the neurologic component that becomes absolutely inseparable from this abnormal joint lesion. Well, why is it neurologically such a big deal with the spine? Well, obviously the spinal cord is down the middle of the spine itself. The brain and the spinal cord are literally one organ. Right, so it's kind of weird and a bit disconcerting when you start thinking in your mid-back, the part of your brain is all the way down almost to your lower back. It's a little strange. But what happens is the joints are lined with these fancy receptors called proprioceptors, nerve endings, right? And it's the movement of the joint that causes the stimulation and the firing of these nerve endings that tells our bodies where they are in space and how much pressure is in there, where they're oriented, and then it sends information up to a back of the part of the brain called the cerebellum. It doesn't matter, but there's a part of the cerebellum, and there's actually part of the spinal cord called the cerebellospinal pathway, right? For these joints move, the movement causes these things to fire, goes up this special part of the spinal cord to this back part of the brain. And that back part of the brain then goes to every place else. It's like a battery in our brain that then goes to things that control mood, affect, even thinking, all kind learning capacities. There's so many different things. Immune function, other organ functions come from the battery juice, if you will, as it winds it up, and it sends this information that primes these other parts of the brain to function more normally. So when we see this abnormal movement of the spine, if we go back to this vertebral subluxation complex, what it does is it changes the way those nerve endings that line the joint, the way they fire. They don't fire appropriately or usually enough going up to that part of the brain. So we see not only pain coming from our back, I won't explain why that is, but it does create that pain. It creates then muscle spasm and tension, which then creates more loss of motion, which creates more muscle tension, which creates even more significant neurologic problems. And that's why so many spinal problems become cyclical and chronic and very predictable once they start, because the pathway is almost always the same once you see it and it becomes chronic. And then we get this neurologic abnormality and it affects the brain, which affects all these other parts. And these specific types of nerve endings, about 55% of them in the entire body are lining the joints of the spine. So that's why it so dramatically affects other things, and why some patients will come in and say, what's going on? My blood pressure is lower. What's going on? My energy is up. What's going on? My bowel movements are normal. What's going on? My respiration and my COPD symptoms are decreasing, and they told me that my oxygen levels are higher in my blood. What's going on? Right? Because of the way it causes these nerve endings to work better and fires into the brain. So that's really your neurologic lesson for the day. that comes from this thing to explain what this type of problem that I deal with each and every day, and the other physicians here in the facility, to actually increase the functionality of our entire system through localized movement of the spine. So that's 3 minutes of vitality for the day. So glad you watch it. We'll see you next time. Thank you very much.